So I heard you wanted to go to CRNA school, but you're not the best at interviewing. Figured I would drop a couple tips, see if I can help you out. So when it comes to anesthesia school, they're looking for a few things, right? They want to make sure that you are clinically adept, usually, as well as they want to make sure that you're a person, right? Anyone can teach you anesthesia, right? Whether you are a person, whether you can communicate well, whether you interact with individuals in a way that doesn't make them seem like they are all medicine is important, right? So, my first real tip when it comes to preparing for anesthesia school interviews is to start early. You don't want to start prepping for an interview when you have the interview, because sometimes you may get an interview invite and it may be for the next week, and if you're thinking about doing a mock interview or anything like that, you may not have time to even set that up, right? Or to really dive deep into the content. So honestly, from the moment that you think about schools, you start applying to schools, you should be starting that preparation, right? Start early. The next thing I would say, most schools require that you take the CCRN. At this point, the CCRN is basically a standard of application process. It's kind of like a baseline requirement. Everyone's going to have that, and then if you have CSC, CMC, anything else after that, that's great. But I always say, study that content, and any of those letters that you have after your name, you better make sure that you know the information for it, right? So review all that CCRN content, do more practice questions, whatever you need to do, just make sure that you have that content down, because again, they want to make sure that we are experts in our field. That's what the CCRN shows us. So if you take that test and forget everything, then are you going to retain that information once you start anesthesia school? I always say next is to know your unit, right? So if you work in a MICU, cardiac thoracic ICU, PICU, whatever you do, make sure that you know the patient population that you're taking care of, their pathophysiology and everything that comes along with that. And to hone in on that more, usually what I recommend is that you pick 3 patient scenarios. So let's say if you work in medical ICU and you pick a hemorrhagic shock, you pick a ARDS patient, acute respiratory distress, and you pick someone in DKA, right? And you go into that interview and they say, okay, tell me about the sickest patient you've ever taken care of. And you say, well, I took care of this one patient. They came in on OptiFlow, they decompensated quickly, and they got intubated. They might say, okay, great. What did they use to intubate them with? You might say, well, they use, propofol and rocuronium. Okay, tell me something about rocuronium. And you say, okay, well, I know that it's a non-depolarizing, blah, blah, blah. Okay, great. Tell me something about propofol. Great. Okay, what other drifts did they end up on? Tell me about the receptors that norepinephrine works on. You said you promed them. Tell me about VQ mismatch. How does a pulse ox work? So they may just keep diving down. So again, I always say pick 3 patient scenarios and yourself do that review. Dive deep on those patients and try to figure out, try to learn as much as you can about the patient, what you did. Again, if you have that ARDS patient, the ARD patient, do you want low FI2, high FI2, high peak, low tidal volume, high tidal volume? If they're, acidotic, what changes are you making to the vent settings? And again, it's just a good review. Now, to go further, every medication that you use, like especially drips, vasopressors, sedation, you want to make sure you know all those medications down to the level of the receptors. You want to make sure you know all the indication, contraindication, side effects of those medication titration parameters. So if you're saying that I use dopamine or dobutamine and you're looking, and they may say, okay, well, if at this dose of dopamine, am I primarily working on this receptor or this receptor? And you're like, I didn't even know that was a thing, right? So again, just make sure that you're really learning those medications in and out. Again, at least to the level of the receptor. The next thing, shadowing, right? Shadowing is not just a requirement, right? It's not just something that you do. Say that I did 20 hours of shadowing and it's done. They want to make sure that you are learning the role of a CRNA, right? They want to make sure that you know what you're getting yourself into. So they may ask you, what is the role of a CRNA? There's no other time. You can read everything in a book all day long. There's no other time other than when you are in that clinical setting with an anesthesia provider that you are really going to truly see what the role of a CRNA is. So take notes of the cases, the drugs, the intervention. You want to make sure you're asking questions at the appropriate time during that shadowing so that you can truly know, what is this person doing? Why do I want to do this, right? And that's the point of shadowing, to see whether or not you want to do it. If you don't know what a CRNA does, why are you applying to be one, right? Next, you're going to want to make sure that you research the program. So the history of the program, the faculty of the program, what research they're doing, their interests, making sure that you can put faces to names. So when you walk into that interview, you can say, hey, hello, Dr. So-and-so, right? You can address them by name. This isn't the first time. They know that they're not just another number for them. You want to make sure that they feel special in a way, right? That they know that you came prepared and you know who they are, who's going to be educating you because you want to be a student there. I would say make sure next that you practice both emotional intelligence and clinical questions, right? Like I said at the beginning, they want to know that you're a person. They're going to be stuck with you for 3 years, 36 months at least, and this program to go even longer than that. So they want to know that they can tolerate you for 36 months. They want to know that when you go into the clinical setting, that you're not going to be weird and freak patients out, or to make your clinical preceptors uncomfortable, that you can work well with the students, because again, this is a 3-year-long process where you guys are kind of grouped together in trauma bonding, right? So both, again, the emotional intelligence questions, again, helps them get to know you, but also lets them know how you will be as a provider, right? How you are as a teammate. Those are all important. Sometimes even more important than being smart, because they can teach you anesthesia, but they can't teach you personality. Next, keep answers concise. If they ask you a question, try to stick to the question. Sometimes, you end up going around the tree, through the bushes, and over through the wood. Make sure if you get off track, try to make sure you remember the question, come back to the question. If you need to ask what the question is again, do it. But just make sure that you are fully answering the question and trying to be concise. So if you can keep the questions to between 30 and 60, or the answers to 30 and 60 seconds, that's great. But just try your best. Be honest when it comes to answering the questions. If you don't know what the answer is, you can say, I apologize, I don't know what the answer to that question is, but I will definitely research that and I will get back to you. And the last thing, right, is after the interview, you want to send a thank you. You want to send a follow-up email. And what you can do is that question that you couldn't answer, that you said you would get back to them on that, right? In that thank you email, just make sure that you respond and say, hey, I did this research on that topic, and here's the answer, because it shows that you are willing to go the extra mile, right? You aren't going to tell them that you're going to research or you're going to do whatever, you're going to try to be better, and then not. It shows that you have a little bit extra drive that other people may not be willing to do. So those are just some quick things and tidbits to help with an interview. But at the end of the day, be yourself. Try to go in with confidence, but be humble. And, hopefully it goes your way.